All of that, now let's bring in the Work and Pensions Secretary, Mel Stride, who's with us this morning. Hi, you want to tell us about 600 quid that's being given to pensioners. How much of a dent is that going to make on their household energy bills?
Well, it comes within a broader package of support for the most vulnerable, and I think this has been a core mission of this government, has to make sure we support people as best we can if they are vulnerable or less well off. So there's £650, which has gone to 8 million low-income households. £300 going out with the winter fuel payments. That's up to £600 for millions of pensioners. 1 million pensioners today will actually receive that amount. £150 if you're disabled, £400 off energy bills, and of course the energy price guarantee, which means that people are saving on average £900 this year on their energy costs. So a huge package, of which pensions are a very important part of it. And bear in mind, Kay, in the autumn statement, the Chancellor announced that the triple lock will be honoured going forward, and we've also uprated pensions by CPI by 10.1%.
And yet civil servants who we're hearing this morning still have to use food banks.
So clearly anybody in a position where they need to use a food bank is not right, and is something that through time one would hope that we will get to a point where nobody needs to use a food bank. What the government recognises is that, as with other countries around the world, we've been really hit very hard by first the pandemic, and then of course by the war between Ukraine and Russia, and the impact that that's had not just on energy actually, but on foodstuffs and other products as well, which has created a lot of inflation. So given that backdrop, we can't do everything, but we are doing the absolute maximum that we can whilst getting inflation down and getting the economy righted so we can get growth and prosperity moving into the future.
And yet people go to the doctor, they're poorly, they should be signed off sick, they won't take a sick note because they have to go to work, otherwise they won't get paid. And our Prime Minister is spending 250 quid to be able to see a private GP at the drop of a hat. You understand the disparity there?
Well, I think as regards the Prime Minister's personal medical arrangements, I do think they're a matter for the Prime Minister. But as I say, what the government is absolutely intent on doing and is doing is making sure that wherever we can, we are helping the most vulnerable in society. So outside of those direct payments that I mentioned, we've also just put up the national living wage by almost 10%, the highest increase in the history of the national living wage. We've already previously made adjustments, for example, to the universal credit taper, so that people keep more of the money as they move from universal credit into work. We are providing all sorts of supports at all sorts of levels, but very much aimed at just the people you're referring to, those who need the help the most.
So you don't think it's any of our business that the Prime Minister can jump a queue if he needs to go and see the doctor, whereas other people have to wait a fortnight?
Well, as I say, I think people's personal medical arrangements are things that if they choose to make public, that's fine.
Well, he does.
But I think
that was his campaign based on the NHS, wasn't it?
Well, and we're totally dedicated to the NHS. Judge him by his actions and the Health Secretary's actions on the NHS.
But he's not using the NHS, he's going privately because he knows
in that very difficult,
he'd be able to see him very quickly.
In that very difficult autumn statement, which had a lot of very hard choices that had to be made, two things really stood out. One was an increased commitment to funding education, but the other was the health service and social care, which actually got quite a lot of money in the near term. So the commitment that we have to the NHS is absolutely central to this government, and that is something that's very much driven from the top by the Prime Minister.
OK, so it's none of our business, you're saying, whether the Prime Minister uses private healthcare.
Well, I'm just saying I think we should respect people's...
OK, let me ask
the fact that they should be able to keep private things like their medical arrangements.
Do you think that people who can afford it should pay to see a GP privately so that other people don't have to wait a fortnight?
I don't think that we should have a situation regarding the NHS that in any way interferes with the fundamental concept of the NHS, which is based on need, not ability to pay.
If people can afford to pay, though, given the situation that we found ourselves in at the moment, should they take the lead of the Prime Minister and go privately?
People's decisions on that are for people to make individually. But as I say, I think that the principle here is that arrangements like that are quite rightly private to those individuals that choose to take those decisions. I don't think people should have to publicly declare exactly what their medical arrangements are.
Even if they're a public servant?
Yeah, I do. I think that there's a principle here. I mean, I understand the sort of line of questioning that you're pursuing, but I think
what do you think people will be thinking at home this morning when they've rung the doctors and they're being told their child is unwell, but then they have to wait for a fortnight to see, and then the guy who's representing them, who wants their vote at the next election, can pay 250 quid and hop in his chauffeur-driven car and go to the doctors?
Well, what I'm saying very clearly is that when it comes to the NHS, that is an absolute #1 priority for the government. Judge the Prime Minister, judge the government by our actions on that. In the recent autumn statement, huge, tough choices had to be made, both on spending and on taxation. But the one area that got extra support, really serious, £8 billion worth of extra support for social care, for example, was the National Health Service. So we are absolutely clear on this. We are totally committed to our NHS. We are totally committed to it being free at the point of use and that it's available for everybody on an equal basis with no queue jumping or anything like that. Money will not buy you preferential treatments on the NHS. It will be there free at the point of use based on need.
What are we going to do about the rail strikes?
So I think what's regrettable is that the trade unions have come forward with a series of dates of strikes now, clearly aimed at causing maximum disruption across the Christmas period. But before you reach the point of strikes, you should really exhaust all the other avenues, because strikes are very serious. They impact not just general journeys, but sometimes people, to get back to the medical points that you're raising, who actually need that transport to get to important medical appointments, for example. So what we need is more engagement and discussion between those businesses that are running the railways and Network Rail and the trade unions in order to come to a balanced, realistic outcome. And what I mean by that is it has to be fair to taxpayers who are funding the railways and put a lot of money into the railways during the pandemic, not least to support the jobs of those working within those railways. But it has to also be fair to passengers when it comes to the fares that they're expected to pay, and it has to work with the public finances. But I think the unions need to engage further on this, and we need to not rush into these strikes at a time that's really designed to cause maximum discomfort to the public.
What are you going to do about the Transport Services Bill? Why don't you bring that forward? So I'm sure you could get it through the House very quickly if you decided to. As a result, there would be a minimum service that would be provided.
Yes.
Why is that taking so long if you're so...
Well, legislation takes a little while. I think sometimes... I say this as a former leader of the House. I used to be responsible for managing legislation going through.
Get legislation through
indeed. And the government has a commitment in that area and to minimum service provision, and in due course I've no doubt that will come forward. And I do think it's important, because I think we shouldn't be left in a position in certain services such as railways where we have such an acute dependence upon them for a variety of reasons.
But there's no plans to bring that
where
forward.
The whole thing can just be, the plug can be pulled on the whole thing.
But no plans to bring it forward. I mean,
there will, in due course, as I say, it is something that the government will be looking at.
Talk to me about a lot of, including former Work and Pension Secretary Chloe Smith. I'm looking at William Ragg, and both quite young MPs, and yet they're saying that they're not going to stand at the next election for your party. What's going on?
Well, at every general election, there are a number of people who step aside. I think in Chloe's case, I think it's for family reasons. She has young children, and she's taken that decision, and I totally respect that. I think what has triggered it in the immediate term is that the party has required MPs to basically take a decision within the next couple of weeks as to whether they stand or not. So I think you're going to see a lot of those decisions crystallising in a very short period of time.
You're right that a lot of MPs do tend to step down. Something like 5% of the House will step down during every election, but not youngsters like these two.
Well, I don't think, with respect to Chloe and others, that they're the only younger people that have decided not to fight a forthcoming election. But I think the most important thing...
That doesn't add any weight to your argument.
Well, my argument is that people stand down, and some of those will be younger and some of those will be older, and you've cited two examples of relatively younger people. But
They're
the
young
important
compared
thing...
to us.
Yeah, well, certainly compared to me. I went into Parliament at age 47.
Well, there we go.
So that was the way I did it. But, yeah.
And talk to me about what's going on with this housing rebellion. There was supposed to be a vote on getting 300,000 houses built a year, and quite a few of your colleagues are saying we don't agree with that for all sorts of reasons. Your boss is worried about losing the vote, and so he's kicked it into the long grass.
OK, well, I don't know that any announcement has been made about rescheduling of legislation. The Leader of the House will come to the House tomorrow as part of their business statement.
So it may still go ahead as planned?
Tell us more about that. Yeah, the answer is I don't know. We'll have to wait and see till the Leader of the House comes forward tomorrow. Yeah.
So what I'm reading in the papers is wrong on that?
Well, the papers are sometimes right, Kay, and sometimes they are wrong. But
yeah,
we'll get the answer to that essay question tomorrow.
It looks like a sieve. Will you use taxpayers' money to have a Christmas party this year? Definitely not.
Definitely not.
OK.
And I think
what would you say to other MPs who are thinking of doing?
Well, it's for them to decide. But look, let's be clear about what's happened here. OK, the general view I think out there is that MPs have somehow designed things so that they're able to charge the taxpayer for Christmas parties and decorations and drinks and things like that. That could not be further from the truth. IPSA, which is an independent body, has taken that decision. It certainly wasn't taken at my behest.
The money, yeah.
Yes. So it then becomes a case of then do individual MPs...
So what would you say to individual MPs?
Well, my decision, I try to avoid lecturing other MPs as to what they should do. I mean, in certain circumstances, I certainly would do that. But I think on this, everybody has to take their own judgment. My firm view is that, in my case, I will not be doing that. I don't think it sends the right signal. I don't actually think that IPSA's decision is the right one. And I know that a number of my colleagues share that view and are quite... quite upset about the fact, actually, that IPSA has put all MPs in a position where the public is saying, well, you're all up to spending our hard-earned money on your Christmas celebrations, and that's not right. I suspect the vast majority of MPs would agree with that, but we've been put in that position by IPSA. What
decision will have you celebrating at the Supreme Court today? What do you want to hear?
Well, I think what we want to hear is just the results of their conclusions, which will be at 9:45 this morning. I don't think it would be right for me to start prejudging that or saying, well, if it's this, I think this, or if it's that, I think something differently. I think we have to wait to see what they come forward with.
Really?
Yeah, I do. I think it's a big moment. There's been, the government put its case, I think, last month with vigour. Other arguments have been put forward. We now need to give the judges just a little bit of extra space to come forward later this morning, and then let's talk about what they've decided.
OK, what do you think of the football?
This is the sale of Ronaldo, is it?
Manchester United.
Manchester United, yeah. Well, I think at the end of the day...
You can talk about England if you prefer.
Well, I think these are commercial decisions. I don't personally think it's for government to weigh in on too frequent
So you're pretty relaxed if the Saudis buy it?
Well, as I say...
Something else you want to talk to me about this morning?
Yeah, well, no, I just don't... I don't think that, we're always urged as governments to get involved in all sorts of areas of sport, and I think that's just one which I might resist.
OK. But you did watch the England game?
I did, and I thought we were terrific, and it was a great result. And
Harry Kane needs a scan.
Fingers crossed. Sorry,
Harry Kane needs a scan on his ankle.
Right. Well, that's a fly in the ointment, as they say. But who knows? I've just got a good feeling about England this time, and Wales, of course, too, who did very well.
Let's not forget that. OK, it's great to see you as always. Thanks so much indeed, Mr Stride. Thank you.